I'm 12 years old and I live in Barnes in London. How many bits of bacon do you want? I like rugby, I like cricket, all the sort of like normal things that a boy likes basically. I like chemistry a lot because basically you get to blow stuff up. Well, not always, but yeah, it's quite cool. I used to be like obsessed with Call of Duty, but I played it like I had like a day's playing time, which is quite a lot. I really enjoy school, and I couldn't get to school, so they had to send me home work and stuff like that, and I was finding it quite hard to do all of the work because I was ill. I was really tired. At some points I couldn't even get out of bed because I was like, my mum had to like pull me out of bed.
I think doctors are picking up chronic fatigue more than they did in the past. It's a relatively common condition that is a recognised condition by the Department of Health with its own nice guidelines.
Should be on time. It's like having the flu, but having it every month. And it's started to get better, especially it helped when I was diagnosed with it at 15 because I knew what was wrong with me, because before then I didn't. Now my friends are getting older, kind of 17, 18. They're all going out at night and on a Friday night kind of thing and at the weekends, and occasionally I can join in. But if I do join in, next 3 days afterwards I'm in bed. You walk into the classroom late and everybody kind of turns around and thinks, oh, she's the one who hands in her homework late or doesn't do it that week. It's not that, it's just sometimes I physically can't. I'm in bed and I can't really move, so or I'll try and do the homework and then I'll be faced with the computer screen and my mind will just go blank.
We liken it to this analogy. Imagine you've got a rock on the side of a mountain with a bird on the rock, and the bird flies off, which then dislodges the rock, which goes hurtling down the mountain towards something that might be in danger at the bottom. Now lots of people want to find the cause, and they'll look and they'll look and they'll look for the bird, but you won't ever find that bird. Mostly it will be a virus that doesn't have a treatment, that's gone, and the effects that it's left are what we need to work with to try and get that person back up to their previous level of functioning.
In a weird way, exercise a small amount can wake you up when you're feeling tired, but obviously a lot wouldn't, but a little bit it can. And just pacing things throughout the day to keep generally, like, so you don't do everything at once, and having the support of the hospital to keep you motivated to actually do things when they're boring and you don't want to do them. Gradually over time you can build things up, but only slowly so that you don't make your symptoms worse or make yourself more ill.
I was feeling really good then, good. Until so there's all 10 out of 10 and 9 out of 10, until the sometime ball, which I was feeling 10 out of 10 beforehand, and then after it in the morning I was feeling 5 out of 10. It was due to the over sort of exercising, and then that meant that I didn't really feel well and I may have been sick or something like that, which isn't very nice.
One of the very common features in chronic fatigue syndrome is disordered sleep, which can be so severe as to cause sleep reversal. So people will talk about lying in bed at night till about 5 AM and then sleeping till about 3 PM.
I've got a personal plan whereby I'm meant to go to bed at, it's going to be a funny time, midnight, and then I have to get up at 9 in the morning. I've been put on that pattern because I work better going to bed later and getting up later.
When people see you, maybe you've gone out once that week as paced and you've only gone out for an hour, then people see you and think you've been out all day and shopping and maybe just skiving school and not going, when really you've had to build it up all week to go out for that hour, and afterwards you rest all day, but people see it as, oh, you're out, you should be going to school or you should be better.
The different studies show different figures of recovery, but it's certainly between 60 and 90% will make a full recovery.
They help you find ways to cope with your life and how to accept the illness and how to deal with it as opposed to feeling like you're on your own.
UCLH would be somewhere where I find hope in the dark, to be honest. Not just a hospital, but somewhere that was willing to take me on when I was at my lowest with chronic fatigue syndrome.